Welcome back to Cancer Buzz, the podcast of the Association of Community Cancer Centers. This week, oncology leaders from around the country are gathering for the ACCC Annual National Oncology Conference. Cancer Buzz will be reporting from the conference all week. Right now, we're here with Lori Schneider. She's the operations manager at Green Bay Oncology, and she's also an ACCC board member. Hi, Lori. It's so nice to see you in person here in sunny West Palm Beach.
Hi, Summer.
This morning, there was a session on financial navigation, and we'd like to talk to you about that. First off, what are the Financial Advocacy Services Guidelines, and what do you think they represent for the field?
So our guidelines are helping the financial navigators or the health systems across the United States trying to come up with a standard of what services should we be providing? What are the standards? How are we going to get there? What do we want everybody to try to come together to be more standard? Because we don't have really standards throughout this whole area yet.
So why is ACCC taking on the task of updating them?
Okay, we have to update them. 2018, I believe, were the last ones, and they really were very high level. We're getting more into what do we need? So that changing landscape of cancer care, the complexity of these roles, how much that has changed over the past few years, and really there are way more financial barriers to care for our patients.
How are those guidelines being updated? I think there's a certain methodology.
Right. We're doing something different. I've never been involved in anything like this before. It's called the Delphi process. It's really very interesting. I've been learning a lot as well. And we've been working together with a panel of experts to figure out what is the overall guidelines. So when I say panel of experts, we have anybody from financial navigation. We could have somebody from policy. We could have administrators, we could have navigators. There's all different disciplines that we've brought together. So we have a good, even amount of perspective to figure out what is it that overall we need for this.
So it's a true multidisciplinary effort.
It is a true multidisciplinary. It is not just the view of one role or one need. It's across the board, a widespread.
What can financial advocates from both small and large cancer centers expect with these updated guidelines?
I think what's really neat is we know that we have different levels of programs throughout the United States. We have hospital systems or small healthcare providers that are just starting the program, and then we have some that have very well-established programs. But we are going to have this broken down so that way we can have what are the must-haves a organization should have versus what are the, wow, it would be really great to have this, and this is what we want to aim for. But we are able to break it down a little bit more and say, here, start with this, make it a little easier on yourself. Here's what our recommendations are for starting. And then here's, after you've started, where are you going to go from there? And then here's your pie in the sky for where you can aim for as a program.
That's fantastic. Thank you, Lori.
Thank you, Summer.
And thank you to our listeners for joining us here at the ACCC 39th Annual Oncology Conference. Keep an ear right here on this podcast channel later today and throughout the week as Cancer Buzz will continue to bring insights from the speakers and the topics right from the conference. Until then, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.